Now coming to Dr. SANITHA. She is the director of Vettam Eye Hospital, which is an expanding eye hospital in mid-Kerala. Over to Dr. SANITHA for new advances in the treatment of amblyopia. She will throw more light into the newer methodology of treatment in amblyopia.
Thank you, Dr. Laila, and good morning, all of you. Thank you, Dr. Andreos, for having me here. And I'll be talking about new advances in the management of amblyopia. No financial interest. So before talking about the new things, let's go into the slide. So can anyone tell me what it is? Okay, these are the medieval masks for treating amblyopia and strabismus. They had different models for the ESO and exotropia. So one thing we should understand is that amblyopia has been recognized as a problem, and that it requires treatment was known from very olden times. And now when you talk about newer advances, I would like to describe it in two sections. What are the new detection strategies and new management strategies? As Dr. Elizabeth has told, the most important thing is to detect amblyopia at the critical period. And what is the gold standard that we adopt now? We adopt visual acuity. But a 2-year-old child, a 3-year-old child, can you use visual acuity? Can you reliably use visual acuity in such children? So this will be discussed in the new detection strategies available. So first one among this is the screening using retinal birefringence. So in the macula, actually you are having this Henle fibers. These are the outer plexiform layer cells. These have a property for birefringence, which if you shine a spot of polarized light at 100 Hertz, if the patient is having a central steady foveal fixation, there will be a frequency doubling, and then the returning light will be frequency doubled. That is, it will be 200 Hertz. And your machine, if your machine could pick up this frequency, you can be sure that the patient has foveal fixation. So foveal fixation is a prerequisite for normal vision. If you don't have a proper foveal fixation in very early life, you are going into the amblyopic phase. So this is what I told. There will be a frequency doubling in case of normal foveal fixation, and in case of unsteady, weaker or non-foveal fixation like you see in an amblyopia, there will not be a birefringence and reduced signal will be there in the returning light. So Blink Pediatric Vision Scanner is a recent device which makes use of this principle. So this is a handheld device which uses a laser probe to detect abnormal foveal fixation. This is very handy, held at 14 inches and scans both eyes in less than 2 seconds. And it is possible to detect misalignment of fovea even up to 1 degree. So that is a very efficient way of detecting amblyopia among small children, and the criteria will be given by the machine as pass or refer. You can follow the instructions. Another similar detection tool is optokinetic nystagmus visual acuity screening. We are all familiar with our optokinetic drum. But now the technology says that when you use a vanishing optotypes on a screen, it is better measure of visual acuity than a conventional drum. So this vanishing optotypes are being used in the objective visual acuity screener, and this has a better correlation with ETDRS visual acuity. Another artificial intelligence based screening is using the Dive Medical, and this is also in market. Actually you can have different stimuli given to different set of stimuli, and then AI can actually detect amblyopia. So there are many other technologies which are in the phase of development. And when you talk about the management strategies also, what is the problem with our occlusion or atropine penalization? The basic problem I would like to say is they do not allow the eyes to train together. So another commonly told things are poor compliance. It is not child friendly. Children find it very difficult, and there is a stigma and high failure rate. But mechanism wise, the major drawback would be they do not allow the to train both eyes together. Why is it so important? When you look into the amblyopia pathophysiology, it is basically histologically proved that there is a dysfunction of lateral geniculate body and cortical connections. And binocular cells in the amblyopic eye are not lost. They are there, but they are suppressed by the dominant eye. And there are also changes happening in the dominant eye when the other eye is amblyopic. So this is a very simple representation. Amblyopic eye and fellow eye have a slave-master kind of relationship. The slave has all the potential, but the master is suppressing him. So when you use something like a dichoptic training, which involves both the eyes, what actually happens is the stimulus to the fellow eye is attenuated in contrast. So stimuli to the amblyopic eye has a better contrast. So this will promote working of the two eyes as a unit, and that is exactly what we need in amblyopia therapy. So it encourages binocular combination of the inputs and it provides better results. So this is a representation. Both the eyes receive both the stimuli and the brain actually has to fuse to produce the, to appreciate that. So CureSight is a instrument or a device which makes use of this principle. It is a binocular eye tracking based digital vision treatment system. You can use any streamed video content. The child may like cartoons, films, anything can be used, but only thing you have to view using a red and blue glasses with CureSight, and it blurs the visual center of the image of the dominant eye using real-time processing. So as the child is seeing that, the right eye is actually having a less contrast compared to the dominant eye is having a lesser contrast compared to the amblyopic eye. So we need to fuse together. So there are umpteen games which make use of this principle. This is a very common Tetris game. Left eye can see only a few colors and right eye the other. So to play this game efficiently, you will have to use both the eyes. Similarly, this is a dig rush game. There are many other games available now. Many of them are freely downloadable. So basically, dichoptic stimulation reduces the fellow eye contrast to balance with the amblyopic eye and promotes binocular vision. And this reduces the inhibitory interactions within the visual cortex by the dominant eye. So visual reality goggles are another addition. Luminopia 1 is a trade name. So this is a digital therapy software. Here you can actually use VR, which visually modifies any content and forces the brain to combine the images. Perceptual learning is a principle which refers to the ability to improve a performance of a sensory task by repeated practice. You do one thing regularly, more you practice, you become good at it. In the visual cortex also this happens. So this is a basis of adult amblyopia therapy in which the concept of neural plasticity comes into place. Dr. Elizabeth has touched upon it, and the brain has the ability to change its architecture. That is what now we know as a result of experiences in different environments and to different activities. So basically it uses GABA patches, and this once you say you start with positional acuity, and then once you train again and again, this improvement is seen in other aspects of visual acuity and stereo acuity as well. So Revital Vision is a device which uses GABA patches to stimulate the brain's visual cortex. This is widely used for amblyopia. So again, from this medieval mask, we have come through patching and monocular therapies, and now we are in the way of binocular dichoptic stimulation in the treatment of amblyopia. Thank you.
Thank you, SANITHA. So, for the nice presentation with the new advances in amblyopia treatment. So, all the 4 topics is over. I think 1 or 2 minutes is left. Anybody, any doubt?